For many men, seeing their body respond as it always did brings a sense of security. But when suddenly pleasure comes and the semen does not appear, the question arises, is everything okay? This situation, known as dry orgasm, is more common than most people think, especially after the age of 60. I am Emily Carter, urologist, and today I will explain why this happens when it is normal and when it needs attention. Here you will understand the causes, learn how to notice the signs, and discover how to keep your intimate health up to date without shame and without taboo. Clear information is the first step to live each stage with calm confidence and quality of life. Before we continue, take a moment to check if you are already subscribed to this channel. This way you will always receive direct information without filters made, especially for those who want to take good care of their intimate health after 60. And I want to hear from you if you have ever heard about dry orgasm right experience in the comments. If this is new for you, write new. Your participation makes all the difference here. It is interesting how the body can surprise us when we least expect it. Many men feel the heat rise, the heart beating faster, the skin shivering, but at the peak of pleasure they notice there is no sign of semen, not a drop or so little that it goes unnoticed. For those who experience this for the first time, the surprise is unavoidable, and the question quickly comes, is something wrong happening? This situation, called by many dry orgasm, is not rare, especially in the mature stage of life. The pleasure is there, the body responds, but the semen does not come out as before. And this is where the confusion starts. Because the absence of semen does not always mean a serious problem, but it is also not something to ignore. It is important to remember feeling pleasure and ejaculating are different processes. Usually they happen together, but the body can change this pattern for several reasons. Some easy to understand, others that need care. I will never forget an older gentleman who told me, a bit embarrassed, "Doctor, I think my body decided to save stock." We laughed, but behind that joke was the uncertainty that worries many men at this age. And this is why information makes such a big difference. Knowing what is just a phase, what is a warning sign, and what needs help is the best way to live this stage without fear or shame. When a man reaches the peak of pleasure and notices that the semen has disappeared or decreased too much, one of the most common explanations has a name few people know: retrograde ejaculation. It may sound complicated, but the idea is simple. Instead of going out, the semen takes the opposite path and ends up inside the bladder. This happens because the internal valve called the bladder neck, which should close tightly at the right moment, relaxes more than it should. The result is that the body chooses the easier path and the fluid moves inside quietly. From the outside, there is no pain or immediate discomfort. The only clue usually appears later. The urine looks more cloudy or whitish, mixed with the semen that was not expelled. And the pleasure remains the same. What changes is the destination of the semen. Many men only notice this detail when there is no semen at all. Others see that the volume has suddenly decreased. This is when worry appears, often without a serious reason. Knowing how this mechanism works helps avoid unnecessary fear and helps distinguish a temporary issue from something that really needs treatment. And if you want to understand even more about how to keep your sexual life active and safe after 60, I have prepared exclusive material for you, the digital book Rediscovering Intimacy, Healthy Sexuality After 60. In it, I explain in a practical way how to deal with changes like dry orgasm, regain confidence, and strengthen the relationship with your partner without fear or shame. The link is in the first pinned comment. It is worth taking a look and investing in your peace of mind. Retrograde ejaculation is silent. It does not give warning signs and does not cause pain, but those who pay attention can notice small signs. One of the clearest appears. Right after pleasure, the urine becomes more cloudy or whitish. This happens because the semen, instead of being released, mixes with the urine in the bladder and comes out hidden through the wrong way. Another detail that often draws attention is the sudden drop in the amount of semen, even when the stimulation and intensity of the orgasm stay the same. For many men, this is confusing. The body feels everything normally, but to the eyes, something seems to be missing. A practical way to confirm if it is really retrograde ejaculation is to do a simple test: collect a little urine right after the act. If sperm cells are found in that sample, there is no doubt the semen went the other way inside. This test helps the doctor understand what is happening and rule out other causes. Many people only notice these changes after starting treatment for the prostate, and this is no coincidence. Some medicines used to improve urine flow, like tamsulosin and doxazosin, relax the area that should block the return path. The result is an unexpected shortcut for the semen. When the medicine relaxes the urine passage, many men feel relief, the stream flows better, the discomfort goes away, and daily life improves. But at the most intimate moment, this same relaxation can change the path of the semen. What should go out finds an open door inside and turns back directly to the bladder. Not everyone notices this change, but those who do often feel worried. The pleasure stays the same, but the amount of semen seems to disappear suddenly. And the fact is that few patients are warned about this possibility before starting the treatment. The good news is that there is almost always a solution. Sometimes it is enough to adjust the dose, switch the medicine, or review how to take care of the prostate, keeping a balance between urine comfort and sexual quality of life. And it is not only medicine that can open this internal door. Diseases like uncontrolled diabetes can also affect the nerves that control the muscles during orgasm. Over time, this problem makes it easier for the semen to follow the wrong path. Prostate surgeries are also part of this list. In some procedures to relieve blockage, delicate parts of the system are adjusted. The result is like a gate that should close at the right moment but stays slightly open, letting the semen return the wrong way. Some diseases that affect the nerves, like multiple sclerosis or spinal cord injuries, can also confuse the signals the body sends to control the release of semen. In these situations, the pleasure does not disappear, but the path that the semen should follow changes direction. This is why knowing your medical history, remembering past surgeries, and keeping chronic diseases under control are key steps to understand where the problem comes from and to choose the best way to handle it without harming quality of life. Many men who go through this do not think right away about having children, but for those who still dream of it, this point is important. Retrograde ejaculation does not stop the production of sperm cells, but it blocks the natural path to leave the body. This makes natural conception almost impossible. In these cases, the semen stays trapped in the bladder and goes out with the urine. For this reason, when I am there is a wish to have children. It is essential to check if the cause is really the reversed path of the semen or another factor like hormone changes or problems in the testicles. Knowing what is behind it makes all the difference to choose the right treatment. For those who still want to have children even after discovering dry orgasm, there are safe options. One is to collect the semen directly from the urine right after climax. In other situations, doctors may suggest a more precise collection, done directly in the channels that store sperm cells to use in assisted reproduction techniques. Not every case needs an intervention, but when there is the desire to build a family understanding, every detail avoids unnecessary frustrations. Clear information at the right time makes all the difference to choose the best path. And when this condition starts to bother, whether because it changes the feeling during sex, affects confidence, or disrupts fertility plans, it is worth investigating the real cause. If everything started after a medicine for the prostate, often adjusting the dose or switching to another option with medical guidance is enough to keep the treatment without losing quality of life. When the reason is a health condition like diabetes, the focus must be strict control of the disease. Keeping glucose balanced, eating well, and following the treatment helps the body recover part of its natural function to expel the semen. There are also medicines that strengthen the internal muscles that direct the semen out, such as pseudoephedrine or imipramine. These do not cure the problem permanently, but in many cases they help restore the proper flow while they are being used. And if the priority is to keep the chance of having children, modern medicine still offers ways to use the sperm cells that do not come out as before through assisted reproduction techniques. The most important thing is to find the real cause and always count on the support of a specialist. Pleasure remains part of life, but now with more knowledge and more safety about your own body. Seeing semen disappear during climax can be scary at first, but as you have seen today, there is an explanation. We talked about what is called dry orgasm, retrograde ejaculation, the effect of some medicines, the impact of diabetes, and even extra care for those who still plan to have children. All of this is to help you feel more secure and informed. Now, I want to hear from you. Have you ever noticed that prostate medicines can change ejaculation? Write your opinion or experience in the comments. This helps many men understand better what they are going through. If you found this helpful, do not forget to support the channel with your like. This way, this content reaches other men who also deserve clear guidance without taboo. And to stay well informed, check out the other videos about male intimate health here on the channel. They are made especially for those who value quality of life after 50. Make sure you are subscribed and follow every week for practical and direct tips made for you. See you in the next video. Take good care of yourself.